Hi, so today's video is about an update on COVID-19 and its related hair loss. We're seeing an increase and an uptick on patients coming in with hair loss post-COVID. So let's talk about that a little bit. Hi, welcome back to the channel. Hope you're doing great today. So as you know, we are in early August of 2021 and in the middle of a resurgence of the COVID-19 pandemic. A lot more cases, and here in Florida, we're in the epicenter of the infection here in the US, and we're seeing cases and the mortality raising. Whether you believe in COVID-19 or you don't, that's not a political video, so don't bother writing hateful comments down below. This is not about telling you what to do or anything like that. But what we are seeing for sure is an increase in the number of patients that are coming into the office complaining of hair loss post-COVID-19 infection. We've had some patients that had hair loss after the vaccination as well, much less. Most of them are coming in, they were either diagnosed with COVID and had very little symptoms, or they were actually in the hospital, got real sick, and all the gamut in between. So if you do have COVID-19, if you had the infection, it's fair to expect a certain amount of hair loss. We don't know exactly the mechanism or mechanisms for the hair loss post-COVID-19 infection. We believe that it's a combination of things: stress, psychological stress, worrying about yourself and your family. Are they gonna get sick or not? Am I gonna get so bad that I end up in the hospital, or even I survive? But also the damage to the body, various degrees of sickness, various degrees of infection levels can cause very big damage to the body in various aspects, the lungs and the kidneys and all that. So hair loss, we know it's a very well-known fact that there is a type of hair loss that is associated with physical and psychological trauma. It's called telogen effluvium, and that's what we're seeing with the COVID-19. So patients with telogen effluvium, they come in and they have a complaint where, well, my hairs are falling like crazy. I wash my hair, I brush my hair, and I see a lot of hair coming out. And so these are hairs that are kind of coming out, not by the root. People say to me, well, I can see the root there. Yes, but what it is the hairs are just kind of getting loose and they're just kind of falling out, but it's not permanent hair loss. COVID-19 hair loss and telogen effluvium, it's a reversible type of hair loss. Most of the time, though, patients have a combination. They have, say, genetic type hair loss, and they have, on top of that, they have the telogen effluvium post-COVID, post-surgery, or anything like that. So it's an added component. There's treatment for that, and the caveat here is the earlier you start your treatment, the better. So as soon as you start seeing any hair shedding that's increased more than your normal, we all shed hair every day. It's normal physiological response, but when you're shedding more. We're all used to seeing a certain amount of hair that we consider our normal. Everybody's different. So when you start to see more, when you start to see hair on your clothes, on your desk during the day, that's a first sign of alarm, and you need to come in and see us right away because then we can institute treatment to minimize the loss and get you to recover faster. The more you wait, the more you're going to freak out, the more you're going to panic, and then that causes even more hair loss too. So we don't want to get into this vicious circle of the hair loss triggering stress, stress triggering more hair loss. So talk to us and we'll give you some advice. We'll tell you, what really works and what you need to do. Okay? So again, what can you do, right? Like I said, early intervention. Come talk to us and we'll tell you what to do as soon as you notice the hair loss. Watch your hair carefully. Of course, take care of your health. Make sure that you recover well, that you are well hydrated, that you eat well. All those things are going to help you recover your hair faster. Supplements can be great, but also we can tell you which ones work and which ones do not work, so you don't spend your money on things that are useless. So the best piece of advice is, again, take care of yourself, protect yourself and your family. As a scientist, as a physician, as a healthcare provider, it is my job to advise you to get vaccinated. But again, I don't want to get into a political argument here. You do what you want. You do what's best for you and your family according to your beliefs. but the science, it's strong on the vaccination. So consider that. Take care of yourself, protect yourself and your family, and call us if we can help you. We can do virtual consultations if you're quarantined or if you don't want to leave your house. We can do virtual consultations pretty much from everywhere, and we'll give you some advice. Okay? So hope this was helpful to you. We're here to help you out. So just give us a call. We can do a free consultation. I'll see you soon. Take care.